Welcome back, everyone. This morning in the Sandwich Generation, we're talking about later in life pregnancies. On Friday, 54-year-old actress Brigitte Nielsen gave birth to a 5-pound, 9-ounce girl. She joins a growing list of stars like Janet Jackson, who are having babies in their 40s and 50s. While it seems to be more common, there are some risks to consider. And Dr. Don Wothe is here with us to talk about that this morning. He's a high-risk pregnancy specialist with Allina Health. And let's just jump right into it and kind of begin about some of the risks that come along with having your baby in your 40s or 50s.
Well, it's an exciting time to have a baby at any point in your life, but in your 40s and 50s, the risks that are added include the risks that most women experience as they get a little older. High blood pressure, diabetes, and there's also a problem that happens in that our bodies are not quite as flexible when we're 50 as they were when we were 20, and so that has an impact, increases the C-section rate, and has an impact on the chances of being in an intensive care unit.
And is it true that C-sections are 7 times more dangerous than natural birth?
They are, and they're about 2 to 3 times as likely in those patients who are in that 40 to 55 range. There are some other problems that happen with older women as well, and I should say they're babies, because those babies are at high risk for chromosome problems, many of which we can test for, but none of which we can actually cure at this point.
What are you seeing with these women? Are they conceiving naturally, or did they freeze their eggs a long time ago and now they're saying, I'm ready to have my family?
Well, I think, well,
they're both natural,
yeah,
but you get what I'm saying.
Absolutely. The most common way for women who are between, we'll say, 45 and 55 to become pregnant is naturally, by just a slim margin. But the ones that conceive with assistance, they have frozen their eggs, some of them, but you can now have egg donations. So egg donations and then sperm from either the father or donated sperm as well. The ones that get pregnant naturally have a very high risk for these problems like Down syndrome and chromosome problems. The frozen embryos actually retain their low-risk status from when they were frozen. So if they were frozen when they were 25, it's like a 25-year-old risk.
Makes sense. So for those who might be at home watching and listening, what benefits could a person see if they choose to wait?
Well, there are a number. First of all, women who are older have generally more resources, and so that allows them the chance to raise their children in a better circumstance.
Okay. Well, we appreciate you being here with us today on Tuesday. You dropped a lot of knowledge for our viewers at home. And if you want to see this, if you didn't get a chance to write it all down, that's okay. We will have it posted on our website, KARE11.com, after the show. Thank you so much.
You're welcome.
Now to our weekly reminder. If you want information on a variety of aging-related topics, call the Minnesota Board on Aging Senior Linkage Line. Experts will answer your questions weekdays from 8 a.m. to 4:30. That number is 1-800-333-2433. We will be right back.